Cranial nerves 9 and 10, the glossopharyngeal and vagus nerve, are typically examined in unison during the cranial nerve examination due to their similar course and function. Start by asking the patient if they've experienced any issues with swallowing or any changes to their sense of taste, voice or cough. Inspect the oral cavity and ask the patient to say ah, and inspect the soft palate and the uvula. Note the position of the uvula. In vagus nerve lesions, the uvula deviates towards the unaffected side. Ask the patient to cough. A vagus nerve lesion would result in a weak cough or a non-explosive bovine sounding cough due to the inability to close the glottis. Ask the patient to swallow a small sip of water and ensure that the quality of swallow is normal. The presence of a cough or a change in their quality of voice would suggest an ineffective swallow, and this can be due to a glossopharyngeal or vagus nerve pathology. Glossopharyngeal would affect the afferent impulses and the vagus nerve would affect the efferent impulses. Perform the gag reflex. Offer the gag reflex. This involves both the glossopharyngeal and the vagus nerve. To perform this reflex, ask the patient to open their mouth and stimulate the posterior aspect of the tongue or the oropharynx using a tongue depressor. In normal healthy individuals, this should trigger a gag reflex. The absence of a gag reflex can be caused by both glossopharyngeal and vagus nerve pathology. A way to distinguish glossopharyngeal nerve and the vagus nerve. Remember that glossopharyngeal nerve and vagus nerve are both involved in the gag reflex, and so the afferent may be lost with glossopharyngeal disease and the efferent may be lost with vagus nerve disease. Glossopharyngeal nerve is involved in taste sensation from the posterior third of the tongue, so any loss in taste posteriorly may be due to a glossopharyngeal nerve lesion. As well as this, a glossopharyngeal innervates the parotid glands, and any parotid dysfunction may be as a result of glossopharyngeal dysfunction. For the vagus nerve, examine the uvula. Deviation is as a result of vagus nerve disease, and that's because of the loss of the palatopharyngeus as well as the salpingopharyngeus innervation from the vagus nerve. Also note that the vagus nerve innervates the cardiovascular system, and vagus nerve pathology can result in loss of the parasympathetic tone to the heart, resulting in tachycardia or syncope. In summary, to examine cranial nerves 9 and 10, inspect the soft palate and the uvula, ask the patient to say ah, examine the patient's quality of cough and quality of swallow, and offer the gag reflex. Thank you for attending this medicine masterclass.